with all of this,
Right.
you've all been alluding to something periodically throughout this discussion, which is adherence.
Yeah.
I mean, docs have to adhere to what they think they should do, and patients have got to adhere to the therapy. What are some practical tips of the trade, if you want, for making sure that docs and patients do what they're supposed to do?
Yeah, so that's, I think, the hardest question. We stink at identifying people who are going to be poorly adherent. I mean, we
Stink.
can
Is
pick
that
up,
in Harrison's under S?
yeah, it's understood. Well, I think we're probably pretty good at knowing someone who's going to be poorly adherent. Like if someone doesn't show up to clinic, they've been in and out of care. I mean, that's.
Or when they tell us, I'm not taking my medicine.
Right. That's actually the best predictor.
They never
right?
lie.
Right.
Not about that.
On the other hand, we're not so good at someone who looks like they're going to be adherent. They're not always adherent, and they'll say they're adherent, and then you call their pharmacy and you learn that their refill pattern is hectic or non-existent. So there are a couple things that Eric said, just to be specific. One is I do think getting that viral load within 2 to 4 weeks of starting. One of the things that I think needs to be impressed on anyone who's doing HIV treatment is that viral load should go down fast. Right? It should go down by 100-fold by 3 or 4 weeks. So if you don't see that, either they didn't start when you told them to start, they're having trouble with adherence, you picked the wrong therapy, or perhaps there's a drug-drug interaction that you don't know about. But there's some reason. If someone doesn't go from 100,000 to 1,000, so then there's something.
An intolerance.
Right.
As a reason
Right.
for poor
Right.
adherence.
So this one we've had is that the patient delays filling the prescription
Right, yes,
and then
right,
comes
right.
in for their follow-up blood test after having taken 3 or 4
3 or 4
days
pills, right, yeah.
of the treatment. And we didn't know that, and they didn't know that. They had to take it for longer. But you're absolutely right. That early viral load signal is
Critical.
key.
And then the other thing that is really easy to do, you don't do that often, and it's easier if you have help, is just actually to call their pharmacy and get the refill information. Because if they're not getting it refilled, they're definitely not taking it. And sometimes patients really believe they're taking their medicine on time and they're getting it, and you bring the data to them and you say, look, here's what your pharmacy said. You filled it in June, July, that's great, but then you didn't fill it till September, and then it was November. And they say, really? And then,
Sure.
and I don't think they're, and so that makes a difference. But in terms of other kind of practical guidance to improve adherence, that's a tough one.
Let me
I
ask you
think,
about.
the amazing thing is if you look at the clinical experience, most people on therapy have undetectable
Right,
viral
right.
loads
So-
now. And I think that adherence is not as great a challenge as it used to be because we are using simple, well-tolated regimens.
Right, and it's not as important as it used
Right.
to be. So like 95% of the patients in our clinic that are on therapy are suppressed. We used to say you have to take 95% of your medicines to be successful. There's no way in hell that 95% of our clinic population is taking 95% of their pills. It just is not happening. So probably you can get away with a lot less adherence and still be successful, right?
And when we talk about adherence, we're not talking about it like we used to. The 95%, everything done exactly right.
Right.
We're really, when we talk about the poorly adherent patient, we're talking about the ones who never show up.
Right.
The ones who didn't get their prescriptions refilled for 2 months.
Right, exactly. That's
And
mostly who we're talking about.
taking examples from another branch, cardiology.
Right.
I found the patients who seem to adhere really well are the ones that you can tell that they're doing well. In other words, if you tell somebody, look, you started a statin and your cholesterol, your LDL cholesterol went
Right.
from
Oh, yeah,
170
no.
to 80, they feel great. They're going to do it again.
Yeah,
Yeah,
you use
well,
people use graphs. They're very helpful.
The other reason to tell people their viral loads early on during therapy is because it's amazingly reinforcing for that exact
Right.
reason.
Right.
You
No,
want to
I
try to
totally,
find
yeah.
that, so.
Or you show people, you see the jigsaw viral load, right? And that's the person you know is not adherent right there.
Got
It's
it.
up and down and up and down. You show them this graph and you say, look here's what's happening when you stop, and it does make a difference.
I do want to say, practically, we partner with a pharmacy in Massachusetts that for patients who are taking a lot of different medicines, not just their HIV medicines, they put together these bubble packs where they have all the days laid out for them for the entire month, and the patients find that enormously helpful. So that kind of thing, even though it's on the edges, does really help.
But the big problem that we really struggle with is the people who are dealing with things like homelessness, substance abuse,
Yeah.
and
Depression,
psychiatric
right,
disease.
Yeah,
yes.
definitely.